Today's episode is information packed. We're talking about how to help your child, or honestly yourself or anyone else in your life, identify, understand, and support through autism spectrum disorder, ADHD, anywhere on that spectrum, and learning disabilities. My guest is Dr. Nechama Sorscher, one of New York City's most esteemed specialists in neurocognitive challenges, who is reshaping the landscape for families navigating autism spectrum disorder, ADD, and learning disabilities. With over 3 decades of experience as both an evaluator and psychodynamic therapist, Dr. Sorscher brings a rare blend of clinical expertise and emotional insight to her work with children and their families. Her new book just came out on April 1st. It's called Your Neurodiverse Child: How to Help Kids with Learning, Attention, and Neurocognitive Challenges Thrive. So we will link that up. This episode is brought to you by Peluva. So Peluva, P-E-L-U-V-A, those are Mark Sisson's new zero drop minimalist shoe with that distinctive 5-toe design. I have been loving them. I've been a longtime fan of barefoot shoes, and I was very resistant to the little 5-toe articulation personally at first, because just being real, I thought they looked really nerdy, and I was like, oh man, yeah, I love Mark so much, and I get what he's doing, but I'm not wearing those nerdy shoes. And then Brad Kearns, who's also involved with that project, was like, no, Tara, you got to try them. Tara, you got to try them. Tara, just come on, try them. And I tried them, and I kid you not, I enjoy them so much that I actually like how they look now. Weirdly, I can tell. So like the purpose of that 5-toe articulation is so that your toes can move more dynamically. So with other barefoot shoes, like I've been a long time fan of Vivos, and I'm still a big fan of Vivos, but they have just that big toe box, right? Which is awesome. So I didn't really feel like the 5-toe articulation was necessary, to be honest. But as I've worn them, I have experienced how awesome that is. It was actually been quite surprising for me. And I wore them this morning. I wear them all the time, and I'm really, really enjoying that freedom of movement on my toes. So yeah, Brad and I have been going back and forth. I'm like, dude, I actually love them. And he offered to sponsor the podcast with Peluva and also offer you guys a 15% off code, which I was like, okay, cool. Yeah, I will gladly introduce my people to Peluva shoes. So you can use code Coach Tara at peluva.com, or you can just go to peluva, peluva.com/Coach Tara, and you can get that 15% off discount. Make sure you snag some of the socks while you're there, because you're going to need the toe socks. Okay. All right, let's get into the episode. We are going to get into so much great information. So please give it a listen, because you may not even realize that you or someone in your family has this going on. And I just love how much compassion and love and support is laced through this conversation. So yeah, get informed. And if you think that somebody might benefit from this episode, definitely send it to them. Be a great entry point. Okay, here is Dr. Sorscher. All right, Dr. Sorscher, I'm so excited to educate my audience today about ADD or ADHD and learning disabilities and autism spectrum disorder, and create awareness around myths and also reality of things that we need to understand. Because I mean, this is your world, but it's not even my world. And I feel like almost everyone is affected, has someone in their life with one of these. And so, yeah, the more education we have around it, I think it breeds a lot more compassion and understanding in ourselves and also in our relationships. So to kick that off, I was wondering if you could start off by sharing some of the common myths or harmful myths around these 3 things, and, what the reality is.
Well, what I hear over and over from my patients, and also from the parents who come to see me and talk about their kids, is that the kids are so often labeled lazy or stupid or oppositional, which I translate as bad, right? It's a bad kid. We don't say that anymore. We say oppositional. We mean the same thing. And basically, it's the same result. It destroys the kid's confidence. It destroys their self-esteem. Just today, I was talking to one of my patients who only was diagnosed with ADD at the age of 17. And he told me that his father would always say to him, I wouldn't be upset with you, but I know you can do better. You should be doing better. And that was so hurtful to him. So the other myth is lazy, right? Not putting in enough effort, not motivated. How many times have we heard this from parents, from teachers, from peers. What's wrong with you? Why don't you understand this, right?
Mm.
And the child is doing the best they can. I believe every child is working as hard as they can. I do not believe in unmotivated children. Children want to please. They want to do well. They can't. And once we kind of can accept that and see what's going on with the wiring, then we can really help them.
Mm, I love this so much because I don't believe in lazy. I think lazy is a cop out for
Right.
what's actually going on with somebody, And so let's start with maybe ADD, ADHD. What is actually going on with them that might present as lazy?
Okay. So when this is how I explain this to people. So ADD is like you're being bombarded by sleep waves in your brain, and you're fighting to stay awake. So if you're in the car and you have a long trip and you're very tired, what do? Roll down the window. You start tapping on the dashboard. You turn on the radio as loud as you can. You want all that stimulation. ADD kids, they're touching everything constantly. What are they doing that for? They're not trying to be annoying. They're trying to wake up their brain. And that's what the medicine does, by the way. And it's not that I'm a pill popper. And I think there's all different ways to treat ADD. But just to explain the wiring, what the medicine does is it wakes up the brain. It creates more dopamine. It creates more energy. And therefore, the kids can focus more. They're very bored. They're very easily bored, and they're very easily fatigued.
Mm,
And that is their wiring. So we need to come up with ways to help them with that
mm.
and understand that they are struggling with just being bombarded with sleep waves. Well, you can't focus when you're tired, right?
Wow, yeah. I love that. That's perfectly explained. And then what about like the oppositional thing? What's going on there?
Well, very often we'll say that the ADT kids are very self-directed, okay? Which means that they like to do their own thing. Now, the truth is, very often ADT kids are very creative. They are entrepreneurial. There is an amazing percentage of CEOs that have ADD, like wild, way above average. That's one of their, what I like to call superpowers. So some of the things I like to reframe. It isn't that they're being oppositional, but they are very imaginative and they are very excited by the ideas in their brain, right? And again, if you just channel that, it's not an oppositional child at all. It's just a child who's saying, I'm really interested in rocket ships and I'm not that interested in multiplication. So let's use rocket ships to teach you multiplication. So some of it is adjusting expectations, you know. I don't believe that any child is oppositional. They want to please, they want to do well, they want to get along. But there's something in the brain that's compelling, right? That's taking over. And sometimes we have to go with the flow. We can't say to them, you have to shut off your brain. Sometimes we have to say, you know what? Write out that idea on a piece of paper, hold that thought, don't, shout it out, and I'm going to get to you. But we have to give them a tool, write it out on a piece of paper, because they get so excited, right? And then they just want to burst it out. So we
Mm,
really have to be very gentle in structuring them and also understanding, again, the whole point is understanding, well, they're not trying to be disruptive. They're not, they're the class clown, right? They're trying to make people laugh. They're not. They're trying to entertain. And that's because their brain is full of those kind of ideas all the time. They're like a little motor wire, moving around all the time, like boom, boom, boom. That's great. We can use that energy. And as I said, often they're phenomenally successful.
wow. Okay, sticking with ADD, ADHD for a second, I've become more familiar with how it's like a spectrum, right? And there's different manifestations like inattentive type and impulsivity. Can you talk about that?
Yes. So it used to be we would say that people have ADD or ADHD, but right now we say everybody has ADHD, but it's on a spectrum. The inattentive type is the absent-minded professor. It's the kid who's spacey. It's the daydreaming, internally preoccupied child who's not tuning in enough to what's going on outside. Okay. Then the hyperactive kid is more the kid who I was talking about, the class clown, the motor-driven kid. I'll often hear the parents say, well, they didn't nap. There was no naps, like they don't need a lot of sleep. They have tons and tons of energy. And it is sometimes very hard to corral them. Now,
Mhm.
typically girls are more in the inattentive, spacey type, and part of that is socialization. We expect and tolerate more boisterous, rambunctious behavior in boys. right? And if a girl is more lively, they get a lot of more negative feedback. So some of
Wow.
it, I think, is social cultural, and some of it is just the wiring.
Hmm.
But there is an overwhelming amount of boys who are hyperactive, right? And if a girl has ADD very, very often, not always, but very often, they're inattentive, they're spaced out, they're dreamy, they're withdrawn, they're reserved.
Wow. And I know you talk a lot about the importance of like early interventions. So sticking with ADHD spectrum, I guess we'll call it right now. What are some signs that you can look for as going from a young age in both boys and girls all the way up to maybe teenagers and beyond?
Well, first of all, I do not believe in diagnosing kids with ADD or ADHD until they're around 7. So it's not that I can't see signs. One time I saw this 2-year-old and I said to the father, "You're going to bring him back in a couple of years. He has ADD. I can promise you that." And he did. But I said, "We're not doing anything about it right now. We don't do anything besides, maybe give them a lot of outdoor activity and, make sure that the circle time is brief, right? Because until they really have to sit down and do work, it doesn't really matter for one thing. And the brain is still developing. I mean, your brain still develops until you're 25, but for sure, from 0 to 7, it's explosive. So sometimes you see these kids and, they really are okay for some time. Um, when I'm talking about early assessment and early intervention, I'm really talking again about understanding as opposed to maybe treatment. So that,
Okay.
I tested a little boy and he was 4 and he definitely had ADD. And he sat down at the circle time. I remember this, and he made a yoga pose. And he sat there like that for around 2 minutes. He was not able to sit through the whole circle time. So when I met with the parents and the teachers, I said, "Listen, this kid really wants to sit down. And look what he did. He did the yoga pose, trying to calm himself down so that he could make it." Now, he didn't manage the whole time. Everybody really appreciated that because they're like, okay, this kid is having a hard time and he is being disruptive and he is very easily distracted and he is very fidgety and he is very restless, but he's really trying. And let's do some gentle techniques. Let's give him breaks. Let's teach him breathing. Let's let him leave the classroom. So there's all kinds of things you can do, particularly in the classroom, which can make the experience a lot easier for these kids. I really believe in giving them movement breaks. So this is a second grader, and he was having a really hard time. And I said, "You know what? Whenever you want, you leave the classroom and run up and down the stairs." That changed his life. Whatever he wanted, which was, maybe every half an hour, he'd leave the classroom, run up and down the stairs, and go back into the classroom. And it was like night and day because he was able to get us some energy and he didn't feel so restrained. So
Yeah.
sometimes a very simple accommodation can really be very helpful. And what my approach is we want to really work with their self-esteem and their confidence. They're going to learn how to read, they're going to learn how to write, and they're going to learn how to do math, whether they are sitting like this or whether they're wiggling, right? But their self-esteem is going to be impaired if we're constantly saying them, "Well, sit straight and, make sure your paper's over here and do this right away." Like those things scar a child's soul. So
Mhm.
the more compassionate you can be, and the more you can give them a little bit of room, whether it's a motion break, whether it's tapping their shoulder to focus instead of yelling at them, whether
Yeah.
it's letting them, have a job that takes them out of the classroom sometimes, all those things, little things make a huge difference for a child. Huge.
I love that. Yeah, the compassion versus trying to force somebody to be fit into a box is like being able to you're hitting on something so deep for me because I feel like um adults now same way because that's how we were parented. It's kind of like this is how you should be, and if you don't fit this mold of exactly how I think you should be, then you're a failure, and then that carries into the adult psyche of like they feel that way about themselves when it's just like maybe the approach was wrong. Maybe you just need a little bit different lifestyle. So I love that you're hitting on that. Um, you're making come to mind for me like the inattentive, like how often is it that somebody has the inattentive and impulsivity stuff going on?
That's happened, actually.
Okay.
People can be a little spaced out, but also very impulsive. Um, And the trouble with attention, right? ADD is attention. So they're going to have trouble with attention one way or the other, whether they're
Okay.
being very loud about it or whether they're being
Mhm.
very quiet about it. The other
Mhm.
piece to remember with ADD people, another superpower, is that they can super focus. They can have a laser-like attention to whatever they're interested or motivated in. And I remember this is a long time ago, I started diagnosing ADD when, it was pretty early on, and people were not happy. At this point, nobody cares, right? You have ADD, it doesn't really matter. That time,
Mhm.
it was like you were telling somebody that they, had to get 4 teeth pulled or something. I mean, they were just not happy. And the parent said to me, well, I don't think my kid has ADD. He plays chess for hours. And I had to really
Mhm.
think about it. And I said to him, you know what? Chess is
Mhm.
very circumscribed. It has rules, it has a structure. Your kid does really well in those situations. But in school, when things are loud and unpredictable and there's a lot of transitions, that's when he gets really disorganized and
Mhm.
has a hard time paying attention. So
And
some
boring.
and boring, yeah. Sometimes they can play Legos for hours, they can do video games, they can do whatever for
Mhm.
hours. Laser, right? But then they
Right.
can't clean up their room, right? Or they can't sit at the dinner table. And boring is for sure. They get easily bored and it's painful for them. It is literally
Mhm.
physically painful the way they
Mm.
describe it. It's so hard to tolerate being bored when you have ADD.
Mm. People who are, kids specifically who are really on that inattentive side of the spectrum, I would assume that maybe they are the ones that typically get hit with the you're being lazy kind of thing. How can we create more compassion and awareness for parents if this is kind of pinging at them like, oh, maybe my kid has that inattentive stuff going on?
Well, first of all, I always talk about the myth of laziness. So I start with that. I start with saying, I think laziness is really a myth. In fact, I'm going to ban that word right now. Let's not.
Thank you.
So that's
Yes,
the first
agreed.
thing. And I do that with my patients too, by the way, because my patients are always telling me because they've been told a million times, that's just for sure. I'm just lazy. I'm like, no,
Mm,
we're not.
mm,
And we don't, and stupid also, we do not. Lazy and stupid, no. They are not words that, we use. Second of all is I think it's really important to try to get into the child's head and be like, well, what was going on when you
yeah.
sat down to do your homework and I came in an hour later and I found you staring out the window? Like, what happened between sitting down to do your homework and staring out the window? Instead of saying, you're lazy, you don't do your work, what's happening, right? And then
Yeah.
you can say, I really sat down with all the good intentions in the world to do my homework. And then I started thinking about the sky and I just had to go look outside for a minute. I don't know what happened to the time then. This is what happens to these kids. They get so involved in their fantasies, their imagination, their daydreaming. They don't even realize. And then actually you can come up with a plan. You can be like, okay, maybe you do your homework in the dining room so that you can see everybody. I do a lot of work with my patients around settings because there are certain settings that are very conducive to doing work. For example, a library, a coffee shop, the dining room table. Because why? They can see people. They're getting some stimulation and it takes them out of their brain and into the work. And I don't expect yourself to do work in your room. It's not going to happen. So we really try to work with, and other people have to do work in their room. They get so distracted, right, that they can only
Mhm,
do work in their room. But
mhm,
usually they're better off doing work in a place where they can see people, not necessarily hear people, but see people. It gives them
mm,
some stimulation. So instead of, I think looking at again the cause, right? Why is the child not doing the work? Instead of saying, you're lazy and you don't do your work. You don't do your work. Let's be curious about that. What
yeah,
happened? Do you just feel
yeah,
overwhelmed? Do you get really anxious? Or with these children, typically it's like, I just started thinking about something else. And before I knew it, it was time for dinner and I hadn't done anything. I don't know
mhm,
what happened. Get really spaced out, right?
yeah. You're making me I actually would like to hear your opinion on, like, pharmaceutical interventions. I mean, I am in holistic health and all of that, but I'm also not, like, I think of, like, bipolar. I don't know, if I had bipolar, I would for sure be taking a GABA and regulating medication, and so I know some of my audience might be like, "Oh," but I don't know. I like to have an open mind and I'd like to hear what your thoughts are around these like, dopamine I'm assuming they're mostly all dopamine, maybe a little bit of norepinephrine or something like that. But what are your thoughts around that for
Sure.
ADD,
Well,
ADHD?
just to say, first of all, I'm very holistic. And actually, I don't know if you know about this product called Rosavan. You probably do.
No.
Okay, so Rosavan is something that they use in Europe for ADD and also for depression, and it's not going to be approved here, and I'm not exactly sure why. But this psychiatrist brought it over here, and I got introduced to him, and he does a lot of different, very interesting things. He also brought SAMe, which I'm sure you've heard of.
Okay. Yeah. I
He
take it.
brought that in. Oh, yeah, me too. Love SAMe.
Mhm.
There you go. And so there, I feel that there are a lot of good products that if you go to a holistic doctor, you find out about. And I'm very into holistic
Mhm.
medicine.
Mhm.
I also am very into regular medicine. And I think
Mhm.
sometimes you need it. What I like to do with the ADD medications is wait for the kid to be old enough where they can make the choice and they can say, and they can also say when they want to do it. I have two kids that have ADD, and one of them also has dyslexia. And then I have another kid who has also some neurological issues. So as a parent, I really walk that walk, right? And my kids, when they're old enough, they took their medicine when they wanted to take it, when they thought it would help them. My daughter took it in high school, and then now she takes it in college. But she takes it, when she has a big test, when she has a lot of homework, and she's very aware of taking it. And I'm also letting them know there's some side effects. So if you hear,
Mhm.
if you get a side effect, happens to be stimulants, the side effects are minimal because it's the kind of medication that kind of goes in and out of your system. So that's also why you can take it or not take it. An antidepressant, on the other hand, you have to take all the time. It built up in your bloodstream. But for a lot of my patients, the antidepressants have been life altering. And depression and anxiety are a lot of us is a sequela of learning and attention issues for all the reasons that we're talking about, right? And sometimes people can't function. They need to take whatever medicine they need, whether it's a stimulant, whether it's an antidepressant, whatever it is. And you mentioned the dopamine, and that's really what it is, right? It's really
Yeah.
getting us to produce more dopamine. Now, there are problems with it. So I'm not saying it's a
Right.
panacea, but I
Mhm.
think, particularly when the kids get old enough. Now, sometimes little kids need to take it because they do things that are dangerous. I treated a
Mhm.
kid who would run across the street. He couldn't help it. Didn't make a difference what you said, whatever, he'd run across the street. He needed to be on a stimulant because unfortunately, he might have been able to get into a car accident. That is
Mhm.
unusual, however. I think that's
Mhm.
unusual. Like that's,
Mhm.
or if a kid is really, really struggling in school. But with my patients, usually I wait for them to be old enough to be able to make those kind of decisions.
Nice. Do you generally recommend any type of like, like tyrosine or mentioned SAMe or TMG or like do you have certain, natural supplements that you like or would even explore with maybe older kids? What are your thoughts on that?
Usually I send them to either a holistic psychiatrist or a holistic neurologist. I know,
Okay.
I live in New York City, I'm blessed, and there are so many fabulous holistic psychiatrists, neurologists, medical doctors, and I know them. Like I really
Yeah,
am aware of that field and I have a lot of respect for them. So I'm like, look, so
cool.
they'll say, hey, I think Rosamond would be great, for example, but I'm like, I want to send you to this guy. He's the one who showed me about it. And they
Cool.
do something else. They may do breathing. They might do,
Yeah.
there's so many different great techniques out there now,
Yeah.
that different even than from 10 years ago,
Mm,
and I certainly am not up on the latest because
yeah.
it's just not my field. So, but that's what I usually do. I'll be very specific, like I want you to go to this person because I know that they'll be good at recommending, a
Hmm.
routine for you.
Yeah. I have a friend with the inattentive type for sure, and she's gotten on, like, neurologics, it's integrative therapeutics. Her doctor, her, like, functional medicine doctor
Mhm.
recommended it. She's been life-changing for her. She's like, "I did
Yes,
not think a herbal supplement could help me this much?" So, I guess just a ping to, see somebody who specializes in that if that's something that interests you.
definitely. And the person can also recommend regular medicine, by the way. Like they're
Right,
MD doctors, they can recommend it.
right.
Whatever's good for you.
Yeah. Yeah. Okay, let's move over. I want to hit on the LD, learning disabilities, for a second because I definitely assume that people with learning disabilities growing up have a lot of emotional fallout from that. Probably a lot of like, low self-esteem, things being said to them feeling, not smart or whatever. How can if you think that your kid might have some learning disabilities, what counsel would you give to them and just things to be aware of, and ways to talk to them and support them?
Well, this is a very personal issue for me because I have a nonverbal learning disorder and I had a lot of trouble with math when I was a kid. And I
Mm,
remember that I was put in this special math class and I was very upset. And I decided that I was just bad at math and math was not for me. And I remember it very clearly. So I would say that a very important piece is when your kid is struggling with whatever it is, math, reading, and so on, to get them evaluated and to get them the help that they need because I could have done math, let's put it this way, but I needed to be taught to me in a certain way. And that's usually what the kids need. So I would
mm,
be quick to assess and to get the appropriate intervention. Like I was put in a special class, but it wasn't taught to me in any way that I could really use. And
right.
to understand there's a lot of hope out there. I just mentioned my daughter has dyslexia, right? And I knew she had dyslexia when she was in first grade. She was having trouble reading. I took her to a reading tutor, so on and so forth. And then I realized when she was in first grade that she was simply memorizing all the books that were sent home. And she was reading them beautifully, perfectly. She had memorized all of them. Very smart kid. I was like, okay, she has dyslexia. And I just knew that. She was in first grade and I, got her some help, got her evaluated, and then she went to a special school for dyslexia and she's doing great now.
Amazing.
But yeah, and her self-esteem is really good. And the
Mm,
reason why I think that happened was because I caught it very early and I got her the help, right? So she went to the special school and the special school was fabulous. And all the kids had dyslexia and they explained you all have dyslexia. And it was just part of her life. And she'll explain it to people now, I have dyslexia and I can't do, she's very, very, very comfortable. And that is because of the early intervention.
yes.
And never did she come across something where it was like, somebody was like, well, why can't you do this? That is so damaging. And,
Yeah.
and that's not even the people who say, well, you're really dumb not to be able to do that, right? But why can't you do this implies all that and goes into the self-esteem issue that you're so,
Yeah.
correctly mentioning. So really it's just really being on top and not sometimes, unfortunately, doctors, teachers sometimes will say, don't worry, they're going to outgrow it. I do not believe in the don't worry, they're going to outgrow it. And I always believe the mother. The mother comes to me and tells me there's something wrong, and they say, I think there's something wrong. The pediatrician doesn't. I'm like, I'm with you. I'm with you, girl. And that's it. The mothers,
Mhm,
no. You need to
mhm.
listen to your voice. That voice inside of you, you know your child. You know when there's something going on. And you need to advocate for your kid and just say, hey, I really think something's going on. I need to get to the bottom of this. Just like you would do, God forbid there was a medical issue. The medical issue, you would not rest until your child was treated properly. Education has to be the same way, and mental health, by the way,
Mm.
just to put in a plug.
Mm. I love this. In my mindset side of my coaching, we're doing a month on self compassion. Kristen Neff wrote a book called Self Compassion, and we're doing our whole this month is all on that. And like, I'm just hearing so
That's
much of it and
great.
what you're saying. It's like
Yes,
coming from an angle of love and support versus like pointing
definitely.
fingers and tearing someone down. Like, that's what compassion is like to suffer with. Like, let me be in this with you and support you versus
Yes.
just degrading you and telling you how you should be and just destroying your self esteem, which I really think like I look at people, especially with the hyperactive, ADHD stuff. Like, I'm like, dude, their whole life they probably got told they were like bad, people mad at them, angry, like, oh my gosh.
You're
Like,
annoying, you're rude.
right, heartbreaking levels. So I love how strongly you're hitting like support them, come in the angle of love. Okay, let's switch over to ASD, autism spectrum disorder. So, in terms of like, early recognition, because even though autism is kind of, becoming more understood or whatever, I still think that there's so much that we may not recognize in our kids,
Definitely.
unless it's like very, very obvious, right? And because it is a spectrum and it can be so different from like a nonverbal person all the way to somebody who's like the what used to be called Asperger's or whatever. Like that's a drastically different human being. So it can be confusing if you're not educated. So what can people look out for in their kids from a young age all the way to maybe teenage years that might be signs of ASD?
Yeah, I would agree 100%. And even it has gotten more popularized. So I have kids coming to my office now and saying, Dr. Sorscher, I think I have, ASD. I think I'm on the spectrum, which never used to happen before.
Mhm.
And, a lot of times they're right. And then the parents will say, oh, dad has it, or
Mm,
grandpa had it, or whatever it may be. And obviously they were not diagnosed. So we're a lot more aware of it.
mhm,
However, there's still a lot of masking and compensating. So basically, when I talk to my patients who, have been diagnosed, let's say, as a teenager, or even I had a young adult come in and she said, you know what, I really think I have autism, but my parents and my psychiatrist never thought I did. I was like, okay, so I assessed her autism, and it explains a lot. So one thing is that people with autism have a lot of trouble regulating their sensory system. So what they'll do is they'll be very rigid. For example, she only ate like 5 different foods, cheese, whatever. And it would drive everyone crazy. And she would be forced to eat, different food that she didn't feel comfortable eating. And that was so stressful for her that she would cry and get really upset. And then she was thought of as a brat, right? She's
mm,
a picky eater. But she wasn't. She was just trying to regulate her sensory, kind of network. And she just had a big reaction to taste and texture. They also will maybe stim in different ways. So the classic stimming you can recognize, right? They're flapping or they're toe walking, whatever they're doing. But there are very subtle stims that these kids will do. For example, they'll be very fidgety, right? Or, they'll crochet. She crochets obsessively, right? And that's her way of stimming. So the stimming
mm,
really helps calm down. But again, if somebody would say to her, well, don't crochet, she would have a really hard time with that because she's regulating. It's not just crochet, right? She's regulating. So you have to take a look and see, well, does your child have kind of obsessive behaviors that they do that seem a little bit off, a little bit odd? Now, the other thing is autism is a social communication disorder. These kids are very bright. They know how to socialize. They want to socialize. They're empathetic. This is a myth that people with autism are not empathetic. Complete myth. They are kind, they are generous, they are helpful, they are cooperative. They are wonderful people. Okay. What happens is they're a little oblivious and they may say things in a kind of a blunt tone. Like if you say, does this dress make me look fat? And they'll be like, yeah. Well,
mhm,
anybody knows you're not supposed to say that, but they don't know. They're not trying to be insulting or hurtful. They just don't know. And they take it a little bit too far and subtle because, again, they're smart and they want to get along. So they're looking all the time. What's this person doing? I'm going to do what they do. And they're compensating all the time, working hard to fit in. But then you see those little cracks, right? Where they'll say something that's off. They'll say to, let's say, I don't know, somebody who's older, Ma, you have a lot of wrinkles, Like they don't know that you're not supposed to comment on certain things. So I'm just telling the truth, man. But sometimes the truth you can't really tell. That they don't like so much. So it's the very subtle inattention to social nuances, being oblivious, monopolizing a conversation, not realizing when they're boring people. I ran a group for boys, and one of the kids had autism. He was adorable. And he was obsessed with trains. And he would talk about train schedules and trains. And after a while, all the kids would start, going out of their minds. And I had to explain to them, look, you're losing your audience. Everybody's looking away. Nobody's interested in what you're talking about. He did not know to look at his audience. We know you're looking at me, you're nodding. I know you're paying attention. Somebody with ASD, they're not seeing it. They are blind to it. So you really have to explain it to them. And again, they know how to get along. They might even be telling an interesting story, but then they say it over and over. And they don't realize, oh, This person's heard that story a couple of times already. You know, they don't get those kind of things. And then they get into a lot of trouble, you know. So and sometimes they don't even know that they're doing it. Now, this my kid who came in and said, I have autism, she did know. And she was very aware. And she actually told me something very interesting, which is people used to say to her, you look upset because of the way her face looked. Because she had to like reorganize her face to look happy, because otherwise people would say that she looked upset when her regular expression was, it just wasn't as cheerful. That's how tuned in she was, actually. But it was so much work for her, right? She always was working to conform. And
Mm.
after a while, it took a really big toll. She got very anxious. She got very depressed. She ended up getting hospitalized. So when we met, I worked really hard on helping her explain, let's say, I can only eat these things. And I can't eat lunch with you because that's too much for me, but I'm happy to go for a walk with you. So she,
Right.
like to help her assert herself and advocate for herself was very
Mm.
important. But we had to break it down. Oh, you really can't eat food with people because the smell really bothers you. You just can't do that. But you can offer them this. She didn't even know that was an option because she kept on being coerced into not only that she had to eat with people, but she had to eat certain foods. So you really have to kind of look into what is going on with the person. And if they would have bothered to ask her, she would have told them, the smell, the taste, the texture, all those sensory things. People with autism often experience sensory stimuli as extremely intense. That's why when they're little, you'll see them, they can't deal with noise. They'll put their hands over their ears, or they can't go to birthday parties because it's too loud, all of that. And as they get older, they might get more accustomed to it, but they often are very uncomfortable. So it's really a matter of also seeing, oh, my child is uncomfortable in birthday parties and only likes to eat white food and, doesn't like to wear, jeans or only wear sweatpants, all those things together. Oh, maybe they're on the spectrum. Let me check that out.
Wow. On the masking thing, I don't know if this is a myth or not, but I saw some video of some psychologist or something saying that girls tend to do that like more, or what are your thoughts on that?
Yeah. So kind of what I said before. So there's a lot of first of all, there's much more pressure on girls to be socially conforming. Second of all, girls are more emotionally and socially mature than boys. You can see that in any classroom. This is not a big, you can see the girls they are taller,
Hmm.
they are raising their hand, they are
Hmm.
lining up. So even a girl with autism, even a girl with ADD is going to be more socially together than, let's say, a typically developing boy, because the girls they're more, so, and that goes on till the end of college. Okay. There's more college graduates that are girls. Eventually, the boys catch up. They do. I think around 25, 26, they catch up. But for whatever reason, and I do think it's because girls are more mature, they go through puberty earlier. I mean, if you ever looked at a sixth, seventh grade classroom and the girls are towering over these shrimpy boys, you just see that their rate of maturity, right, is different. So they do tend to mask more. And they also are just much more socially with it. So they understand how to get along and they figure it out faster, and therefore they're underdiagnosed. And I actually meet women, not even young women in their 40s and 50s who are like, oh my God, I am on the spectrum. And they did not realize that because they were so busy trying to just be like everybody else and succeeding, really succeeding. Where the boys, they're not that interested. Even typically developing boys are like, I don't really care what people think about me. All I really want to do is play ball and play video games. That's all. They're simpler creatures. And you see that even in junior high school where the girls are totally into the drama and, the mean girls and all this. And the boys are just being boys.
Yeah.
And the high school, it kind of starts to tip the other way.
Mm. Thanks. On this, like not picking up on social cues, like we have a lot of autism in my family. And when you said like they're wonderful people, it's like that's at least that's my experience is like
Yes.
the people I know without they're like so sweet natured,
So
like
sweet.
so sweet. And
Give you the
so
shirt of the back.
it can be difficult to even want to like if they're going on and on and on and on and on and on about stuff, it can be difficult even in the family to say something because you're like, "Oh, I don't wanna hurt their feelings." Like, they're so excited about this thing. I have no idea what they're talking about, and this has been going on for a while, but I don't wanna hurt their feelings. What do you say to that?
I think that's a really genuine concern. I felt that way with that boy who was going on about the trains. And what I tended to do, and what you could do with your family members is, first of all, is prepare. So say, hey, I know you love this topic, and I know you get very excited about it. And you know what? I want to hear. I want to hear all the details about this topic, but I only have like 5 minutes because then I have to go and do XYZ. So you don't say to them, you're going on too long, you're boring me, whatever.
Right.
You do a frame. And it's kind of
Nice.
what I said to this kid. I was like, listen, it's great that you know all the train schedules from Boston to New York. It's fabulous. And I really want to hear about it, and the boys want to hear about it. We want to hear about it for around a minute and a half. So what I'm going to do is I'm going to give you a minute and a half, and then we have to give somebody else a turn, right? So then it's a way of not, because I think, again, we're talking about compassion, being kind, your delivery and just the tone is so important. Because if you be like, and I know you're not going to do this, but some people are, they're like, hey, that is way too much information, right?
Yeah.
It's harsh. That's
Right.
hurtful, right? So you don't want to say that because they like the information and want saying some details. It's great. I want to hear all the details. I want to hear it. And then you really are very concrete. When it's
Mhm.
4 minutes, you say, hey, this has been great, so exciting. You got 1 minute left. So
Mm.
you are, cueing them. And look, they may say, why are you only giving me 5 minutes? Might be, I can only give you a minute now, but then I can come back and give you another 5 minutes. And that actually also
Mhm.
works for you because it doesn't burn you out. And you could
Yeah.
even say that. You could be like, you know what, my attention span for this kind of stuff, it's very real. It only lasts for 5 minutes. So there's
Yeah.
just a way of being, I mean, what I try to do very much is put myself in the other person's, point of view. What do they want? They want to be seen and they want to be heard.
Right.
And the other thing that I taught this kid that I don't think could teach your family members, but maybe what I taught this kid was I'm indicating my interest and I'm also indicating my disinterest, like I said. And I would exaggerate it. So when I was really into it, I'd be like, and really listening and saying, wow, that's so great. And then when I was done, I would also very exaggeratedly go like this. And they picked up on that because sometimes it's not that they are meaning to bore you, they don't realize that they're boring you. So if you really exaggerate your facial expressions and just be like, and then go back and be like, hey, I'm kind of done with this, you know what I mean? They are going to catch on to that. And they're not
Mm.
going to be hurt as
Mm.
long as you are genuine, as long as you're like,
Yeah.
I really do want to hear. And I hear that from you.
Mm.
And yeah, I can't really emphasize enough how sweet people with autism are. And I really, there is such a stereotype, right? That they're unfeeling and they're kind of like robotic.
Yeah, they
So
can't
not
love.
true. They can't love. And now, of course, we have all these great shows, Love on the Spectrum and so on.
Yeah.
Adorable. But that still is a pretty pernicious myth, you know?
Yeah.
So,
Yeah. Yeah, thanks for sharing that. Um, last thing is I'm wondering like, okay, I'm wondering this about kids, but I'm also I know this isn't super your area, but come on, like I know even like older people, right? Like because you said like sometimes people figure this out because there's so much more awareness. Um, how do you talk to a loved one, like someone in your family maybe about like, "Hey, I think you may have this." Like how do you handle that conversation?
by the way, I'm in the middle of writing a book actually for adults. So I work a lot with
Oh, nice.
these issues. Yeah.
Okay.
And one of the things I talk about in the book is that having either attention, learning, or autism takes a huge toll on intimate relationships with your boss, with your kids as a parent. And I give really good strategies. Book is not published yet, but I'm hopeful. And I'm working on it. I'm very excited about it. So this
Is
is
this for
definitely
all like ADD and ADHD and all the neurodivergent stuff? Oh,
correct.
nice.
So the first book that I wrote was for therapists, how to work with these clients. My second book was for parents and teachers, and I thought about it as kind of a trilogy. And the third book is for the people themselves, like me, right?
Nice.
Yeah, because I found techniques to help myself, right? And I have to say, I think diagnosis is often a big relief. And I think being seen is often a big relief. So if you have a loved one and you think the person has ADD or is on the spectrum or has some kind of learning disorder, there's two things that really work well. Number one is, I think, self-disclosure. So if you have something that you're struggling with, in my case, right, I have learning disorder, I self-disclose that all the time. I told you about it, but I do it all the time with my patients when I'm testing, because I feel like it, first of all, levels the playing field, right? You're not coming up and saying, I'm great. I don't have any problems. You, my friend, have a ton of problems, right? Like, I have some problems, and I want to tell you that when I'm aware of my problems, that's really helped me. And I'm thinking that you're struggling with X. I'll give you an example. This is a hypothetical example, but actually, no, I'll give you a real example. So one of my friends told me this funny story about her husband. And basically, she'd been asking her husband for around 6 months to give her some very important papers that she needed in order to get her kids' passports. And her husband said they were in his study. So she finally said to him, listen, I need these papers. Can you please go and get them? This is important. I got to, take care of this. Yes, right away. Runs to his study. 15, 20 minutes later, goes over to the study. He's busy on his computer. What are you doing? Oh, I'm working. What about the papers, right? Now she was able to deal with that because she understood he had ADD and they both laughed and so on and so forth. But
Right.
if she didn't know, it would have been
Right.
a huge fight. I would have heard about it in my house in the Bronx, right? What are you doing, right? So you can say to the person, listen, I've noticed that you do X, Y, and Z. You're forgetful, or you have a really hard time getting along with your boss, or you've just gotten some, not so great feedback from one of your kids about your parenting, whatever it may be. And I'm thinking that this would be a good time to be curious about what's going on in a general way. And one of my thoughts is that maybe you have some neurocognitive challenges. And again, I would be soft about it, right? Even if you think the person is autistic, let's say, I wouldn't say that right away. I would say, maybe you have some neurocognitive challenges. Have you ever thought that? So then you get
Mm,
them to reflect and be curious. And
yeah.
then you say, you know what? Maybe you should check it out with an expert, or
Yeah.
it's a book that you think they could read, or a podcast that they could listen to, or whatever it may be, to give them more information. And the other thing I
Yeah.
always explain to people is information is power. I think it's so great that you're doing this podcast. And the reason why I think it's so great is because you're getting information to people who need it. And at
Yeah.
this day and age, podcast is a great way to do it, right? Um, and people don't feel alone. They feel like they're
Yeah.
supported. They feel like they have a community. So if you can just head your loved one in that direction, and afterwards they might come to you and be like, hey, you know what I found out? And they may not even credit you for that, right? I found out I have ADD. And you're like, good for you. Right?
Yeah.
That's the best case scenario, just to get them thinking, to get them to be able to advocate, right? Right?
Yeah.
And kind of just give them information, and then they will use that information and however they see fit, right? Hopefully
Yeah.
in a great way, because I believe that the more information you have, the better off you are.
Yeah. Yeah. I love that you said it's like a relief. And I think any of us who, have found something out like that about ourselves, it is a relief. It's like, oh, I have some sort of framework now to understand what I'm experiencing. And like, this is a lot of people experience this. Oh. And then you have tools and resources and
Exactly.
examples and support. And it's like, okay, cool. Yay. Because there is suffering associated with these things, even though, there are superpowers also, but there's suffering that is internally
Definitely.
experienced. And so to get a path out of that, who doesn't want some sort of path out of suffering that they're experiencing that they don't even understand what on earth is going on?
Definitely. Like I remember when I was reading about nonverbal learning disorder, and I was like, oh, I have that. And I actually was very happy. I was like, this really explains so much. And it made me,
Mhm.
I was thrilled, you know? And I do think that diagnosis can be transformative, therapeutic, and that is the way I use it. And again, I'm not really into labels, but I think it's important to understand that There's something going on with your wiring that's causing you to behave a certain way. And then again, like you said, there are tools and resources.
Yeah. Is there a certain progression, like a way of starting that you recommend? Like, do you just go to a therapist? Do you like find some sort of, autism specialist center? Like, you know what I mean? Like, if you're hearing this and you don't know where to start, where do you recommend people
I mean,
start?
I'm a big believer in assessment, and I do assess adults. And I know not everybody can get assessed, but I think that to me, that's really key. Because just talking to a therapist, and sometimes, yes, and the therapist can really guide you, but you really need the data. And I think getting assessed is a very important piece. And I have found that when, I do assess both adults and kids, we can come up with a plan much easier because we have the information that we need. So that's what I would recommend. And I do think finding a specialist, finding somebody that you trust, is also really, really important. So
Mm,
once you have the data and once you have the information, and sometimes you don't need to be assessed. Sometimes you're like, okay, you have this. Then you need to find a specialist, particularly somebody you have confidence in, somebody you vibe in. The chemistry is very important in that kind of relationship.
yeah.
And I think, yes, I think get yourself educated, read podcasts, join, there's so many wonderful organizations, Autism Speaks, Chat. There's some, really great organizations that you can join and get yourself support.
Mm. For people who may be interested in reaching out to you directly, do you work remotely with people
I do, but I'm based in New York, so I do telehealth, but only, in
in
New
New
York.
York? Okay. Okay. Cool.
Yeah.
Just curious.
But I've had people, actually come see me from different states. Because the assessment itself is, that's just something you do that can take a couple of days. So people can come and do that. And I do some of it by Zoom, but not most of it. And COVID, of course,
Hmm.
a whole other topic I'm sure we could talk about, but we got more comfortable with Zoom, but I think it's better to do things in person.
Yeah.
For sure,
Yeah.
the test is better to do in person. Therapy, you could Zoom.
Hmm.
Testing, you have to do in person, in my
Yeah.
opinion.
Okay. Thanks. Yeah. Assessment. I mean, it's kind of like me thinking of going over somebody's blood labs. Like if you're trying to do it yourself, like you don't even know what questions to ask if you are new to something, whereas somebody
Right.
assessing can just be like, oh, do these pieces. Like, oh, let's look at their zinc and,
Right,
you know,
I know. Just putting the
yeah.
pieces of the puzzle together, definitely.
Right. Okay. Wow. This was so informative. Thank you so much for taking the time to come and educate us. Thank you for taking the time to write these books. We will link up Your Neurodiverse Child, How to Help Kids with Learning, Attention, and Neurocognitive Challenges Thrive, which just came out, right? That one just came out. And we'll link up your website. I'm assuming you have one other book, you
One of the
said?
book, yeah.
One other
Mhm.
book. I'm assuming they can find that through
Psychotherapy,
your website. Yeah.
definitely.
Okay, cool. Well,
Well,
thank you
thank
so
you. Thanks so
much.
much.
Yeah, this has been amazing. So appreciate you taking the time to share your expertise with us.
I appreciate you having me on the podcast. And like I said, if you wanted to anytime share whatever's going on, and if you have any reports that you want me to look at, I'm very happy. I love to do that stuff. That's really my
Okay.
passion.
Thank you so much for joining me on this episode of the Inside Out Health Podcast. I hope it's been helpful to you in your journey. If you think that it might be helpful to someone you know, please share it with them. Please share on social media. It really helps me grow the show and reach more people with these amazing messages. And if you could be so kind as to rate the show and possibly even leave me a review, that really helps. So much thanks in advance if you do that. And yeah, please subscribe if you want to hear more of this type of content. I have lots of amazing expert guests on the way. All right. Thank you.